My name is Daniel Kisicki. I am a primary care sports medicine physician, and I practice at Cheyenne Family Medicine as well as Wyoming Orthopedic Sports Medicine. Most of my patients that I see locally are involved in our high school athletics or at the community college athletics level. Depending on the sports season, my sports medicine team at Wyoming Orthopedics and Sports Medicine can sometimes see upwards of a handful of these patients per week, depending on the season. A concussion is a functional brain injury that changes the way the brain works, basically. There has to be some sort of injury or trauma, typically to the head, but even to the body, that creates a cascade of events in the brain that basically changes the way that the brain works. It's not a structural injury, it's more of a functional injury. Theoretically, a concussion can occur with a number of injuries. These can occur in motor vehicle accidents, bike wrecks, someone tripping or slipping and hitting their heads. So we do see those in our general population in terms of concussion management as well. From an athletic standpoint, obviously our contact and collision sports are much more higher prevalence in terms of concussions. These involve sports like football and soccer as some of our more commonly seen collision and contact sports that involve concussions. But theoretically, they can occur in basketball, wrestling, cheer, rodeo. We see them across the board in most sports. There aren't a whole lot of sports that our young athletes play that I haven't seen someone with a head injury in that regard. Again, all it takes is some blow to the body or to the head that then changes the way that brain works, that then leads to that cascade and the symptoms that then occur. There's a wide variety of symptoms, and that speaks to the complexity of the injury itself and also the complexity of recognition and management. We have a symptom scale that we use in our initial intakes, and it has 22 of the most common symptoms seen in concussion. And these range from anything from headache to dizziness, neck pain, nausea, vomiting, balance problems, sleep issues, concentration or focus issues, memory, sensitivity to light or sound. We call it just feeling in a fog, basically just not really feeling right, fatigue, anxiety, depression, irritability, mood changes. So as you can see, there's a wide variety, and not every patient, in fact, not every patient at all is the same. We have a kind of a joke saying in our field that if you've seen one concussion, you've seen one concussion. It's not like, oh, if you've seen one, you've seen them all. They're very individualized, and every patient can present in a different fashion. Some studies show that upwards of 9% of all high school athletic injuries are concussion-related, but they're a very difficult injury to recognize sometimes and diagnose. So those numbers a lot of times are not necessarily as accurate as we'd like to see. We unfortunately have a lot of concussions that go undiagnosed, untreated, even unrecognized, either because patients want to cover up their symptoms or they just don't understand that there's something going on with them. So that's really the challenge that we have, not only in our community, but across high school, collegiate, and professional athletics across the country. Typically, when our athletic trainers or parents or coaches are seeing potential concussions on the sidelines, it's usually something along the lines of a patient who looks confused, potentially has loss of consciousness, but not always. A lot of people focus on the loss of consciousness as a degree of severity or that it needs to be present in concussions, but actually only about 10% of concussed patients truly lose consciousness. So we don't necessarily hang our hats on that as being a major contributor, but sometimes we will see that. But the athlete who is normally very happy-go-lucky and joking on the sidelines, who becomes very, very quiet, very serious. On the flip side, the one who doesn't normally say anything and he's cussing or yelling, or the super tough guy on the sideline that is all of a sudden crying and in a way that isn't their usual being after having some sort of a hard hit. Those are the patients that we usually pull from play and really keep a close eye on, because there may be some suspicion that they may have sustained a concussion in those settings. Recognition is first and foremost one of our key items that we preach and teach, and that comes from, in a formalized setting like our collegiate or high school athletes, As you mentioned, athletic trainers are our first and foremost line of defense in terms of recognizing and treating these initially. A lot of our local athletes are seen at urgent cares or the emergency department frequently as a first line because a lot of these injuries occur after hours or on the weekends when a lot of our athletic events occur. Certainly a patient can seek medical treatment from their primary care physician if they have one. As we said, in certain scenarios, if the athletic trainers are present, they're our first line of defense in starting that recognition and assessment. And then we're really trying to reach out and develop a good sense of community and a lot of resources here that allow people to know the different resources that are available so that they can get our patients to a clinic like ours where we can do a thorough assessment and take over management if needed. A lot of these injuries can be treated, especially in certain populations, by primary care physicians and others who take the time to learn how to recognize and treat some of these symptoms. But if there's ever question or a prolonged recovery or a more serious issue with other medical conditions, that's where we're happy to put our input in as well. So whether we're dealing with an athlete or someone who is just in the general population who has had some sort of a head injury and has a concern about a concussion, as we talked about, first and foremost, we want them to be seen by some sort of a provider. Their primary care physician is a great place to start in terms of initiating that assessment and management, whether this is an athlete or whether it's someone in the just general population that had an injury. We always watch for what we call red flag symptoms that might prompt a more urgent or emergent evaluation. And these are things that involve a prolonged or recurrent loss of consciousness, persistent vomiting, extremely severe headaches or neck pains or other injuries sustained in the trauma or injury itself. Things along these lines are worrisome symptoms that typically will prompt someone to be evaluated in the emergency room or even in an urgent care if it's after hours, as opposed to waiting until the next day to contact their primary care physician. So any of those types of symptoms are symptoms that we do encourage family members, coaches, trainers, things like that to get the patient evaluated in a more prompt fashion. Our management and treatment focuses on, number one, getting the patient in and evaluated, as I've talked about, and really educating the patient, their family members. For our young athletes, that's usually their parents. I start off right away by really stressing the fact that I am an advocate in their care, and I'm going to do everything I can to return them to the classroom, first and foremost, but also to their selected sport as quickly but as safely as we possibly can. Creating that team approach can be really important initially, and gaining that trust amongst one another in terms of being honest about symptoms, about progression or regression of the symptoms over time, really will help us as providers provide the best care that we can.